I think if you're taking this seriously as a road to self-improvement and defeating some of these long-time struggles, I think you need to give your body and your mind time to properly recover. And I think you need to respect how strong these experiences can be.
Ketamine Connections, welcome back. My name is Anna. I'm always excited that you're here. This week's episode, Dr. Evan Husted. What can I tell you? Well, let's play an imagination exercise first. So I want you to imagine that you are walking into a clinic for the first time. You've done your research. Maybe you've been listening to the show. Maybe you've even gone through the ketamine preparation protocol and feel really informed. And you still have your excitement, you have your apprehension, you have all of the feels of walking into your first treatment, and the person that is feeding you the medicine, the provider, doesn't actually know what the medicine feels like. And there's no shame around that, right? When I was being prescribed psych meds, I was not in the expectation that the doctors, knew what the psych meds were like. And I think that's something that's really unique to ketamine and something that is changing with this psychedelic model of healing. What we're seeing is more providers being psychedelically informed, more providers actually having experience with the medicine. And that is the guest that I have for you today with Dr. Evan Husted. He is someone who is walking the talk and someone who has his own life transformation through the medicine that we touch on a little bit today. In that conversation, we talk about how stigmatized it is for providers to be informed about the medicine and how that goes back to his med school days. We talk about the pedestal that we put our white coat providers onto and how the psychedelic model of healing is changing that. And we talk about how can we humanize these providers, right? How can we really see our MDs, our doctors, as our friends, as our peers, as our mentors? Our system as it is right now is truthfully not built for that. However, that is something that we're seeing changing in the ketamine space. And the vulnerability and the honesty and the rawness that Dr. Evan Husted brought to this episode is so refreshing in that way, in showing that our doctors, our humans, our providers can have experience in what we've gone through. And, as Ram Dass said, we're all just walking each other home, right? So when you have a provider that's a few steps ahead of you, you're able to know that someone knows the way. And that's not to say you should only do ketamine with providers that have done ketamine. That's up to you to fact check against yourself and what is true for you. We are providing so many resources around the clinical space to build out this platform so that people like you can have the information that you need, whether your provider has done ketamine or not. All of this is here to give you options. And at the end of the day, if you are choosing options, whether it's the provider or the support system that you have for preparation or integration, or the support that is going to hold your hand through this process, I want to remind you that the most powerful guides are the ones that have been there. So really seeking out support for people that know your case, that can relate to you, and that know psychedelics as well, and really making sure that you have a robust support system. That is what we cover in this episode today. Dr. Evan Husted is such a big advocate of preparation, as am I, of proper support, as am I, of not making it all about the ceremony with the ketamine, but also having other tools and other structures in place to support you. We get into all of that in this episode, and it was really a delight to talk to someone who is walking their talk, who in 2020 had their own breakthrough with ketamine. We talk about the story of how he got into that. And if you've ever wondered how to build a support system around your ketamine journey, we get into that in this episode as well. So I'm really excited for you to listen, and let's dive into the show. If you're listening to this show, I already know something about you. I know that you care about doing this work well. You're not just here for an experience, you are here for real, lasting change. So let me ask you, how are you ever going to get the transformation you want from ketamine if you aren't clear about what to expect? The only way to make sure that ketamine actually works for you is to get clear on how the mind works and how ketamine interacts with your brain. the rules of psychedelic use so you don't make the same mistake I did, and how to be prepared for anything. And yes, I mean anything. And those questions only get answered when you follow a solid preparation protocol. Unfortunately, most clinics don't offer this up. Maybe they refer you to a therapist, but most therapists don't understand subconscious work or psychedelic work. And with anxiety, ketamine can only do so much. However, I also have good news. That is exactly why I created the ketamine preparation protocol. It is a simple 3-step process to help you feel safe, supported, ready, and yes, able to trust the process so that your journey is powerful and life-changing, not left up to chance. Go ahead and visit the link in the show notes and get yourself prepared, whether you've already started ketamine or are going to soon. All right, back to the show. All right, we're live. Welcome to the show, Dr. Evan Husted.
Thanks, Anna. Appreciate the invitation. Looking forward to the conversation here.
Same. And so, as we always do, we start every guest interview with the same question. If you can go back and tell the you before you started all this anything, what would you say to him?
I would tell them that you're worth getting the help, and the help is out there for you to get, I think.
I'm curious, what version of yourself are you talking to?
Sure. So I am talking to Evan when he was just beginning medical school. I think that's the time I've identified as when my mental health started to decline. And really it was, boy, um, almost 15 years after that when I finally started to look for the help. So, um, you know, I don't consider that lost time. Like I've been in therapy for a while, so I had to go through that to get where I am today. I understand that now, but I would love to go back and just give that Evan a hug and encourage him to get help with the things he was struggling with.
Yeah, and I think so much of what you're talking about, for me, what resonates is the social constructs that would have kept that version of Evan, right, from seeking the help in so many ways. One, we place so much on our physicians, on our MDs, on our doctors, right? So it's like we're expecting them to be superhuman in some way. So for that version of you to even ask for help is kind of defying that social construct that we have. And then also, I mean, I have family and friends that have been through med school. It to me, the experience, it's almost like a hazing experience where there's so much put on the training that it's like weeding out anyone that would break under that pressure.
Yeah, it's definitely an intense experience, and it was, I had friends that washed out, like friends that decided they didn't want to do it. Like after going through so much to get there, it's it's a stark reality to confront that maybe this isn't for me. And I had friends that washed out. I also had friends that had taken on so much debt by the time they arrived there that they were terribly unhappy, but felt obligated to continue because of the financial investment they'd made in their education. So yeah, it's a rough way to do it. I don't know. I don't have the solutions for making medical education more humanistic. Um, I I'm encouraged by what seems to be like a better emphasis on mental health and wellness in the residency programs and in the medical schools themselves. Um, I had a young person who is going through the same training I went through, like same institution, reach out for help at the clinic this week. And that's a really wonderful thing for me because, you know, just like your opening question, like I wish I could go back and talk to that young version of myself. So I guess the next best thing is just helping other young healthcare workers, young people. Um, so it's an inspiring thing. Looking forward to working together with that person.
Yeah, it reminds me of this quote that I heard a long time ago where um, the difference between a hero and a villain. And so if you look at the archetypes of those stories, of the tropes, they have the same beginning, but the villain says, I experienced pain and now I want to inflict pain so people know what it's like. Whereas the hero says, I experienced pain that I don't want anyone to experience. So I'm going to make sure that I become an example of that in the world so people don't experience that. So sounds like you're a true hero.
Oh, wow.
I mean, that's I think the first smallest step to eliminating what I call kind of hazing of the medical training. But it's also touching on a point of how our concept of mental health is changing as well. Right. I really have seen that. I feel like coming out of COVID, normalizing the conversation of being in therapy, normalizing the topic of what's going on in internally, right? And just making that more common and mainstream than I've ever seen it in the past.
I need to credit the pandemic experience with my own, like, finally, my own final decision to actually try to get myself feeling better. Like, you know, that was what kind of led me to my, like darkest mood and the heights of my irritability and improper sleep, everything. So it put me there. It finally like brought me to a place where I finally accepted I did need the help. And, you know, it wouldn't have happened without the pandemic, probably, or maybe it would have taken a few more years. So it was hard to live through, but I certainly came out of it a healthier person and a more well person, I think.
Good. And someone who probably has a lot more compassion for the people that you serve now, knowing what it's like to be in the trenches of your own dark place.
Yeah. So it's so much different than my previous gigs for that reason. Like, you know, in most situations, like, you don't want to hear about your providers suffering or hear about their own personal journey. Like, you go to the doctor and you just want to hear about getting yourself fixed. You want to hear about resolving whatever issue brought there. But, and when I was an emergency room doctor, like, yeah, I wasn't sharing my emotions or my like personal journey of wellness with the patients. Like, nobody was there for that.
Yeah.
It was a different kind of a job. But now I am, administering ketamine treatments, but also preparing people for their first one. And it's a pretty weird, it's a pretty weird thing to go through. And, if I hadn't gone through this journey myself, I wouldn't know where to begin even preparing people because it's not like other medicines. It's very unique, and feeling disconnected from the room or feeling disconnected from your body, if people aren't properly prepared for that, you can have acute panic reactions. You can have panic attacks. And I'll say that, like, uh, almost without exception, every patient I've had in the clinic has some form of anxiety disorder because, it's very rare that depression just exists on its own or PTSD just exists on its own, So everyone has some anxiety that they struggle that they bring to the clinic with them. So having them feel prepared uh, is really essential to them getting the most therapeutic value out of the treatments.
Yeah, absolutely. That's my specialization with the a lot of the preparation work that I do is working with people with a history of anxiety, and I kind of woke up to how hilarious that joke is for me because anxiety is an overactive predicting like malfunction, right? Anxiety is trying to predict the unpredictable, and so my job is to take people who have that overactive mechanism and prepare them for something they cannot actually prepare for, right? Because you don't, every psychedelic journey is always different. And so it's kind of like beefing up the toolkit to for someone to be able to handle anything without knowing what that specific thing is.
Yeah, you raise a good point. You're preparing them for the unknown, right? You're preparing them for an experience that you can't define for them. You say, but by preparing them, like you're preparing them for the unknown, but you're also you are preparing them to begin the practice of relinquishing control in the context of these treatments, and that is often the more difficult part. Like getting people ready for the unknown part of the experience. I will often make comparison to dream space, how it's like kind of like dreaming while you're awake. And so say, well, as in your dreams, like the only limit of what you can see is your imagination. So sometimes you see beautiful things, sometimes you see things that are more challenging. Things can be disturbing. You can go back to dark moments in your own life, imagined moments. And people are, people get it because most people understand dream space. But the idea of relinquishing control is a lot more difficult because, you know, once like adolescence kicks in, we're like pretty much trying to be in as much control as we can all the time. And by the time you get to your 40s, you've been doing it a long time, and it's hard for some people to let go.
There's so many other factors at play because you're absolutely right. By then it's you've been doing it for a long time. It's a very habitual action, but not just that, it's usually gotten people to pretty high levels of success, right? So it's a mechanism that it has a very intentional feedback loop of like, well, this is the thing that's worked for me, right? This is what got me through my education. This is what got me through career, family, whatever it is that people have used that way of thinking, right, to accomplish. So putting it down, it feels unsafe and unfamiliar because, well, no, how do I function without that? That's all I know. And it's such a double-edged sword because it's all I know and it's gotten me so far, but it's not going to get me to where I want to go because it's also causing so much pain.
Yeah, it's a practice, and
Yeah.
most people don't get it on day one, but you can definitely see improvements, and that's so wonderful to see. People get it after one or two sessions, and they are able to just relax more, and they feel safe in the space and are really able to, squeeze more out of it than the people who are really white knuckling the the transition.
Yeah, it reminds me of a quote. You don't have to be great to get started, but you have to get started to be great, right? So if relinquishing control is a skill, just like anything else, like reading, walking, driving a car, riding a bike, right? It's like that skill of being comfortable in the unknown, of just like trusting yourself to get yourself through anything. It's a muscle, and if you've never flexed it, it's going to be quite weak.
Yeah, well said.
Yeah. And so also speaking sort of tangential to that is, the importance of providers like yourself actually having experience, right? Because one of my friends who owns a ketamine clinic in Scottsdale, Arizona, Dr. James Latham, he says, ketamine's a show you, not a tell you, right? And so if you have providers that don't know, that are just trying to tell without actually having seen it for themselves, right? It's like, how do you see that?
I think it's really essential in the preparation that the patient has interactions with someone who's experienced the medicine themselves. Like for me, as someone who's been a ketamine patient and is now a provider, like feel like that's something particular that I bring to the clinical interaction because it's not like any other medicine, and there needs to be a respect for how unusual it can make you feel. And if you haven't felt that, weirdness yourself, I think you're going to have a hard time preparing people properly. I think experiencing the medicine is not something that's really stressed in medical education. I was a neuropharmacology uh, biology major undergrad, and I had one professor who insisted on always trying the medicines they researched, but they were seen as an eccentric, and
Yeah.
I guess looking back, I thought of them as an eccentric also. But ketamine is very particular. It's not. I know of other providers who uh, treat it like they're just administering an antibiotic or any other medicine that would go in an IV in a clinical setting, but it's different, and it's got very different stages of response. It activates people in very different ways. Um, and if you're not there to reassure people and calm them, then they can spiral into anxiety pretty quickly. And as I said, like, everyone who's doing these treatments already has an underlying anxiety disorder. So you need to be particularly careful with these people and responsive when you see that anxiety is starting to rise.
Yeah, absolutely. And it's also, I think it's one of the biggest missed opportunities of the field right now is for the proper preparation for people to know that it is a different medicine that follows a different model of healing, right? It's like the traditional sort of Western model of medication, right? It's like taking something to treat a symptom and not really always going for the underlying cause of it. Whereas with psychedelics, you are giving a window to the subconscious mind where all of that patterning, all of that conditioning exists. And so for people to come into it thinking or just not even knowing, not even understanding and being educated that it's a totally different model, it's a totally different way of interacting with a medication, way of interacting with the medical system. And even to your point, right, of yeah, like providers having experience with the medicine instead of it being eccentric or uncommon, it being almost essential for this specific field.
Yeah, definitely. You need to know how it feels, but it's important to know what some of the pitfalls are. And no better way to figure that out than to experience them yourself, I would say.
And so you've journeyed with ketamine yourself and saw great relief from everything you were, well, maybe not everything, but most of what you were experiencing.
Yeah, I mean, I've still got work to do. I'm still in therapy, but I've come a long way from before I started the treatments, and that was in 2022. I did my first treatment. My first treatment I did in my primary care doctor's office, and at that point, I hadn't really come to terms with how bad my uh, depression and PTSD symptoms had become. Like, I was doing a treatment more in an experiential sense to understand the medicine. I didn't realize how badly I needed it myself. And it was really that first treatment that gave me a boost in my mood that I didn't even realize how badly I needed, and just really helped me realize that I'd been under a dark cloud, and I hadn't really allowed myself to feel happy. I have two young girls, and there are certainly moments of joy, but there were a lot of times where you know uh, I should have been reveling in the joy of being loved by two young children, and the uh, the mental health struggles just made it really difficult to appreciate just how wonderful that is.
I like to think of it like one day you just put on a backpack, right? And every experience of depression or every day that you pass with it, it's almost like a stone in that backpack, right? But because it's just so incremental, right? It's like if you're already carrying it, what's a little bit more? What's a little bit more? And then you get into the ketamine and you have an experience of putting the backpack down and you have a lived experience of what it's like to not carry that weight, even if it's just for that duration of the ketamine journey itself. But that's also the importance of integration, right? Is that the integration is to create a lifestyle that works towards that rather than people who aren't as educated thinking, oh, I can only have that when I'm in ketamine, right? Like I can only experience that. And there's, that's where we see abuse come in.
I try to be very wary of the fact that it is a potentially addicting substance. I don't have great concern about creating addicted patients from the way our protocol operates. You know, the only access to the medication is within the confines of the clinic. I don't prescribe or advocate for home use of ketamine. Um, I understand that there are a lot of people, like during the pandemic, that were able to access the medicine for home use, and it has helped a lot of people, but I'm concerned about the safety of people self administering the medicine. It can make you feel euphoric, and it's promoted as a cure for depression, anxiety, and PTSD. So you're putting people in a position where, you know, they're going to self administer. And if they're not feeling as good as they want to feel, they're going to continue to give themselves more. And then you can get yourself into a pretty dangerous situation because of the nature of the medicine. It interferes with our ability to perceive and interact with our environment. So, you know, even people who would consider themselves ketamine experts, like ketamine researchers themselves, have gotten into trouble over the years, like, and have died of hypothermia, going outside without proper clothing on, drowning in their own bathtubs. These are things that can happen, and if they can happen to experienced users, then they can happen to anyone. So um, I think responsible use within the confines of the clinic is how I feel most comfortable sharing and administering the medicine. Um, but there's a lot of different ways to use it. So I don't like to like poo-poo colleagues who do lower level dosing and perform therapy while the patient's under the influence of the medicine. Like, it's just that's not what I do, but it sounds like it could be effective. So that seems responsible. I just do it a little differently.
I agree with that. I personally, my personal take on it is I advocate for doing it outside of the home with supervision and support for a lot of reasons, for all the reasons that you just mentioned. But even more so than that, when you are going somewhere outside of your home, you're already signaling to the subconscious mind that you're doing something different. Whereas if you stay right, and also most people, I don't know what conditions people live under, but if you're doing something at home, right, ketamine is going to take you out of your regular mundane routine and also out of your comfort zone. But if you're in the comfort of your own home, it's I just think there's like a ceiling on how much you can get uncomfortable when you're so comfortable being in your own environment.
That's a good point. I hadn't thought about that, but yeah, there's a lot of value in just taking the step outside your home and knowing that you are like embarking on a journey towards wellness. Like it's important to take those steps. I agree with you. Yeah, like that in itself is therapeutic in some way.
Yeah. Especially if we're talking about, patients with a history of depression, a lot of that is, resistance or hardship leaving the home. But also, you walk into a space like most ketamine clinics that I've, visited around the country, and then you talk to an MD who is more of a peer than, the old like white lab coat sort of, and you're already that person is already having an experience of, oh, I'm in the medical system, but something here is different. And that's already starting to ripple throughout the subconscious mind of like, what else is going to be different here? What else is going to be unpredictable?
Most people are pretty surprised how how much I want to talk about their previous uh, drug experiences. So people are, some older people are digging back and thinking about things they did 30 years ago. Um, but it's important to know what they've used in the past and how they felt, and what their comfort level is. And I've found that people who have stretched their mind out before coming and looking for help with us, like, they tend to need more ketamine to reach a psychedelic state. So it's important to know that. We're going to start them at a higher dose, most likely. And I feel better starting them at a higher dose if I know that they've safely gotten weird and come back into their bodies and been fine, described it as a positive experience afterwards.
I love how many times you've used the word weird in this in this conversation. It's one of my favorite words, and anyone who's worked with me, they just kind of like, because I always say, "Can I ask you a weird question? Can we talk about something weird?" And with time, people are like, "Every question you ask is weird." I was like, "Okay, good. Now I don't have to like ask you every time." But it's like, if the common and the ordinary work, then we wouldn't be here having this conversation. We got to get a little weird to shake up the routine and to shake up the those well paved grooves of how the subconscious mind is just working in patterns, right?
Yes, yes. And I'll say, like, I can't think of any patient I've had who hasn't tried at least two medications before coming. You know, uh, the ketamine clinic is no one's first stop for seeking to improve their mental health and wellness. Like, it always comes after trying SSRIs in some form, trying some other prescribed pharmaceutical, being in talk therapy, and feeling stuck, feeling like you're either not feeling the highs or the lows, or you just feel like you're not making progress. Like, this is very common. So um, I'll tell people it's going to be a weird experience, but that they're there to get weird. Like, that's the idea. That's what you're doing here.
Yeah. And so with that, you were just talking about dosing a little bit. I know that you had mentioned wanting to talk a little bit about the difference between a psycholytic and a psychedelic dose. Do you want to educate our listeners about that?
Yeah, sure. So there's several levels of ketamine intoxication, and people know that it's abused as a street drug. People will use it to, enjoy a concert more, to go dancing with friends. Um, when they're experiencing the medicine like that, they're experiencing it on a psycholytic level. So this doesn't mean that you are in like a mind transforming experience. It just means that you feel a little loosened up. Some of your barriers are down. Maybe you feel a little less anxious, and so more willing to share, more willing to dance, more willing to be a genuine version of yourself. And there are some providers who will administer low level ketamine specifically so people feel those effects, and then will do therapy in the moment. Um, and this is a perfectly reasonable use of the medicine, but I like to get people a little deeper. So if you add more ketamine to the psycholytic experience, it becomes a psychedelic experience. And this is when you feel a separation from the contents of the room, potentially a separation from your own body. And because of the way ketamine works in the brain, it prevents incoming sensory information from reaching your cortex. And when your brain is not getting the normal amount of input, it creates a movie for you to watch, kind of like an immersive movie experience where what you may see or experience are at the limits of your imagination. Um, but what you may see or experience are only limited by your imagination. This may come with emotional release as well, but certainly a deeper experience than what you get at the lower psycholytic dosing. Now, because you are feeling distant from the contents of the room and potentially from your own body, there's no therapy that can be done in the moment because you're not going to be interested in talking to me. Um, you're going to be able to give basic commands, like if you want, maybe you're feeling chilly and you want a blanket, maybe you want the music turned down that you're listening to, music turned up, you want the song skipped. People can give those kind of commands, but complex, like higher level thoughts not happening in that moment. However, what happens during that experience, we want people to take into their next talk therapy session with them. And talk therapy is mandatory at our clinic. I'm not a therapist and I don't pretend to be one, but I do have a network of talk therapy providers in the city and in the surrounding area. I'm in Philadelphia, that are interested in working with our clients and doing this particular kind of integration work.
That's so you just explained so much more eloquently something that I've been saying for a long time, which is if the ketamine alone transformed lives, then everyone who did it at a rave or a nightclub would be enlightened.
Yeah, it would be great if it was that easy, but no, I don't feel like I'm shooting silver bullets and just fixing people. It really takes a commitment by people, like, just to improve their health, mental health, and wellness generally, and that means outside work. The people who are just coming and doing the infusions and wondering why they're not getting better, like, unfortunately, like, getting better means hard work, and in therapy, that means talking about the things you don't want to talk about. It's hard work. The the ketamine makes it easier, though. Like, that was certainly my experience. Um, I was in therapy and I knew the things that, were in the dark corners that I really needed to talk about, but sometimes it's painful. Sometimes it's embarrassing. Sometimes it just makes you feel terrible just thinking about it. So it's hard to get the words out when you're sitting in front of your therapist, but the ketamine can make that easier. And people are really motivated by that idea. And during the treatments themselves, I said you feel a separation from the room, a separation from your body potentially. What comes with that is often a separation from your symptoms, your intrusive thoughts of negativity, rumination, things that can, keep us awake at night. Turning the volume down on those things just temporarily and being able to live and breathe, know you're alive, and not experiencing those symptoms. That's something very motivational for people.
Yeah, absolutely. And it's also like everything you're saying is, I learned a long time ago that we don't get to as much as we want to, and we have an entire society based around picking what we want to feel, right? Like I want to feel joy, I want to feel happy, I want to feel, present, but the gateway to that is feeling the grief, the anger, the embarrassment, the hard emotions that we're often not educated how to feel, or that that is the pathway, because there's this truth that if you want to go high, it's in proportion to how low you go, right? So most of us, with what we were saying earlier, with the depression, with the anxiety, it's almost like a flat line, right? You're not going too low, but you're not going too high. And so to be able to get honest about the lows so that you can then go to the highs is something that is so deeply uncomfortable.
Yeah, it's hard. It's hard.
Yeah, it's work, right? And that's what we say, right? It's like it works if you do.
Mm, yeah.
Yeah. And so what are some of the changes that you've seen just with the clients that you've worked with?
Treatment resistant depression people just get lighter and brighter. Like, you know, I go by like their subjective input as they move through the process. And in most cases, I'm like speaking collaboratively with their therapist or with their prescriber, you know. But you can see a physical transformation, which is really pretty remarkable. Like the flat affect of people with severe mental health struggles where they're not feeling either highs or lows, you know, seeing like true emotions emerge or just seeing them laugh at their partner's joke as they arrive at the clinic, like things that are a major transformation, like subtle things, but you know, the way they carry themselves, the way they speak, they go from monosyllabic to interested in telling me what's going on in their lives or something they're looking forward to when maybe they weren't looking forward to anything before we got started. Um, those are the biggest transformations I see, and you know, seeing joy on their face or you know, feeling the gratitude in the room when when their partner or a parent is there and they're seeing the transformation along with me. That's really wonderful.
Yeah. Do you ever take a photo of the patients and before their first and then after?
um, I don't. That's an interesting idea. Um,
There's a noticeable difference.
it's real. I don't know if I can get people to go along with that one. But it's genuine.
It's genuine and it's real and same thing. And I work with clients virtually, on Zoom rooms, etc. And clients will show up and I'll say, "You look different," and they go, "Oh, really?" And they start to notice it for themselves as well of how different their energetic field is.
Yeah, and I always tell them too because we're very good at beating ourselves up. Everyone with a mental health struggle is their own worst critic in most cases, and you know don't like to give themselves credit for progress or don't like to recognize that they've done something good for themselves or for the people around them. So try to let people know as often as possible that I see these changes and that they're a sign of healing and they're a sign of growth and progress.
Which is also very therapeutic for people to feel seen and feel a part of something, right? That's like in the Maslow's hierarchy of needs, belonging, right? So even just having another human reflect you back to you is also has therapeutic benefits.
Yeah, I agree with that completely. Yeah.
Amazing. Well, anything else that you want to mention before we wrap up here?
No, I feel like um, you know I don't think that doctors have been magnificent stewards of this medicine. I have colleagues that I respect very much, but I also know people who are providers, but I don't think have proper respect for the medicine or the experiences that the patients go through. Um, I feel like people do better when they do a proper amount of preparation with their therapist, when they have support and approval from their partner or whoever is closest with them socially. And aftercare also is something that, we've talked a lot about therapy, but just something as simple as giving yourself time to heal and recover. Um, it's difficult for people to take a day off of work, but um, that's really what I recommend. I get people who come from other clinics or they move to Philly and need to establish a new therapeutic home, and sometimes it boggles my mind to hear about clinics where they will administer an infusion and say you're okay to go back to work. Um, Now I don't know what your job is. Maybe that's okay. Maybe you can be, slightly intoxicated to perform your job. But I think if you're taking this seriously as a road to self improvement and, you know, defeating some of these long time struggles, I think you need to give your body and your mind time to properly recover. And I think you need to respect how strong these experiences can be. And that means proper reflection, proper nutrition and rest, not just diving right back into, you know, your daily life and the responsibilities you have there. Sometimes it's not possible to take the day off. So I have people say, well, can you take half a day off? Can you have 2 hours when you get home where you're just going to say, I'm not going to do anything, but just rest and be with my thoughts and do some journaling? These things are important. And, you know, being a good steward of the medicine doesn't just mean like being safe in the clinic. It's thinking about people getting ready for the experience and then integrating properly afterwards. So I try to put a lot of emphasis on those things.
And especially to your earlier point, right? It's not the medicine itself, it's so much more that happens around it. And if you're, I struggle with the same thing when I work with clients, of clients not feeling like they can take a full day off of work. But it's a little bit tricky because anything you do before the ketamine is going to prime you for what you experience. So if you have something that's stressful that happens before the ketamine, you risk, it's not like you're going to, but there's a risk that you'll take that into the ketamine session. And then if you're whatever you're doing afterwards, you want to use that window of heightened neuroplasticity to make different choices. But if you're going into a well-paved environment where you're doing the same thing over and over, well, then you're just digging in deeper into the grooves that are already set. So I really agree with you on that, even just that one point of, really getting a day off. And if people could do it bumped up against the weekend, if they have weekends off and just take 2 days off or 3 days off, then what gets to happen in my experience is that the medicine gets to unfold, right? It's not isolated, but then it's like the beginning of something rather than a standalone.
Yeah, well said. And to that end, I'll say Friday is definitely the most popular day at the clinic.
Yeah.
Everybody wants to do it on Friday and have the weekend.
Yeah.
But can't all be Friday people, unfortunately.
Yeah, so plan ahead, right? Book ahead so you get that Friday slot so you can so you can really take advantage of that, unless you have, the space to take time off of work or whatever your arrangement is, where you can create space to really let the medicine unfold, meaning that imagining that whatever happens in the journey itself is just the beginning. And the more space you give it, it's like one of those little sponges you used to get at the museum that's crumbled up, and you put it in water and it slowly unfurls, right?
I love that. Yeah, yeah. Unfolding is a wonderful word. Also, yeah. I always tell people that they can really surprise themselves what they're capable of.
Yeah, exactly. And that's why I loved your logo too, where it says start your therapeutic journey, right? It's like this is the beginning. This is the sort of, like, I think of a trailhead, right? Like you're just starting. So it's like starting the therapeutic journey, rather than what a lot of people come into the space with is like, okay, how can I fix this? And how can I fix this as fast as possible? And as you said earlier, it's like we're never done. Might as well enjoy the journey, because it's, as long as there's breath, we're going to be becoming who we're meant to become.
Beautiful.
Well, Dr. Evan Husted, thank you so much for being on Ketamine Connections today. We'll have all of the links in the show notes so people know where to find you in the Philadelphia area. And thank you for a beautiful conversation.
Yeah, thank you so much for having me. It's wonderful that you are educating people about this. There's a lot of bad information and fear mongering about what is a very safe medication in the proper context. So, yeah, have people sign up for our newsletter. And
Perfect.
I'm looking forward to speaking again soon.
Sounds good. Thank you so much for tuning into Ketamine Connections with me today. If this episode supported you, the best way to say thank you is by sharing it or leaving a review. And if you're enjoying the show and you want to connect more, I would love to see you on my newsletter. That is where I share behind the scenes insights, thoughtful guidance, and other parts of your ketamine journey. Never spam, always fun. And honestly, since getting kicked off of social media in 2024, it's where I share the real stuff. I share stories, tools, updates that I don't post anywhere else. So sign up at any of the links in the show notes and you'll be the first to know when I'm hosting live Q&A or when I'm doing other fun things that are not available anywhere else. It's the best place to hear about it, stay connected, and grow together. All right, that is all I have for today. Thank you. Stay curious, and I'll see you next time.